Welcome back to the Balance HI podcast, the show where we make healthcare make sense one episode at a time. I'm your host, Samantha Louigene, HIM Director, Digital Health Strategist, and the woman who will absolutely stop a meeting to ask, okay, but where is the record, though? And today, oh yes, we are unlocking some doors, literally and figuratively, because your health should not be a mystery. This is not a medieval fantasy show where your lab results are written in a dragon language on ancient scrolls. No one should have to interpret ancient scrolls, prophecies, or anything of that sort just to understand whether their cholesterol is high. If our last episode was Patient Portal 101, the starter packet, the entry level, the what is this thing, then today is the glow up episode, the remix of some sort. This is the remix, the stadium tour version of digital health. We're going from, I think I have a portal, to I run my health data like Fortune 500. We're talking patient portals, but from a whole new angle. Personal health records, PHRs, your health vault, why HIM professionals, plus clinical informatics. We gotta give props to our informatics team, are the visible architects of all this, and why every patient, parent, caregiver, and overworked professional needs to stop sleeping on this immediately. New examples, new shows, new punchlines, new drama. So buckle up, unlock your doors, because your health story, it starts with you, not the system. Picture this. You walk into a restaurant, order your meal, and the chef says, oh, don't worry about what's in it. We'll let you know later. Maybe. Absolutely not. Absolutely not. That's chaos. That's early season medical drama energy. Everybody running around, no one knows what's going on, and somehow the answer shows up in the last 5 minutes. The subway door is closing. And yet, that is exactly what people do when they do not use their patient portal or built a personal health record. They go to the appointments, they get blood work, they have imaging, they pick up meds, and then they walk away with 0 receipts? No. No ingredients list? Hmm. No record of what happened? No idea what's being tracked, coded, billed, or watched over time? No, this can't be real. This is not a real thing. They are essentially eating blind when it comes to their own health. In 2025, about to be 2026, not using a patient portal is the digital equivalent of walking around with a flip phone. Yes, you're alive. And yes, it technically makes calls, but you are missing the entire point of modern life. Not having a patient portal in the 21st century is like still carrying a flip phone. You're alive, but you're missing the whole point. Sorry, got to repeat that again. Now let's level this up. Let's refresh the basics, but from a more grown digital health perspective. A patient portal is not just, let's see, a website, an app, or a place where, or a place when someone says, we sent it to your portal. hmm Yeah. Um, in that tone that sounds suspiciously like we did our part. Yeah, the data's in your portal. Yeah, I'm sure you have heard that, or maybe you haven't. A patient portal is your front row seat to your own healthcare, your virtual backstage pass, your personal all access credentials into how your body is being documented, coded, and managed. If your medical life were a long running series, the EMR is your production room. And the patient portal is your streaming login. No logging in, no access. You're not watching the show. You're hearing about it secondhand. Let's name some of the usual suspects. MyChart, Epic, HealthLife, Oracle Cerner, Athena Health Portal, Meditech Portal, Follow My Health, Allscripts, or your hospital's own brand version. Different logos, different logins, different quirks, same core ideas, maybe the same login. I don't know why I said that. Here is your health information in a place you can reach without begging for it. Please give me access. And this is the part where I say my favorite thing. Let's see. A patient portal is the difference between watching your life and actually directing it. Wait, and action. Oh. Clear the queue, director. Because when you're in the portal, you're not waiting to be told your story. You're reading it, you're catching it, you're correcting it, you're adding to it. You are not the background extra in your medical narrative. You are the director. Did you hear me? You are the director. Sit in that seat. Now, you know I cannot talk about portals and PHRs without calling in my people, the health information professionals. And let's sprinkle some clinical informatics in there. Because nothing about this ecosystem just works. You know those clean tabs that says medication, allergies, lab results, visit notes, immunizations. That did not appear out of nowhere like a plot twist. That was designed, structured, cleaned, governed, argued about in meetings, because I know I have. We should have this tab or that tab. I have fought for a lot of things to be seamless. Reconciled and audit. Those allergy lists that are neatly organized inside of a wall of chaos, that's HIM making sure terms are mapped. And informatics, don't forget them. Entries aren't duplicated, and data actually means something. Make it make sense. Those lab results that show in very nicely structured format with reference ranges, that is the health information professionals, along with informatics and IT and lab folks working together to make raw numbers human readable. That portal that did not crash, that portal that did not crash the second 7,000 patients logged in, looked at their COVID tests, that's informatics, that's IT, that's clinical leaders, vendor partners, all building stability. And that's me and my people, health information professionals. Informatics plus HIM are the unseen, like I said, Avengers of healthcare. Without them, your portal will feel like a 2008 smartphone. Cute, but useless. Let's be honest. HIM protects the content. Informatics optimize the container. Together, they protect your data, decide what displays, help design what flows, configure what gets released, and fix it when something goes wrong. If you've ever opened your portal and thought, wow, I would actually understand this, you should probably think a health information professional. And informatics, of course, person or professional. Silently or loudly, your choice. Okay, patients, caregivers, busy professionals, this part is for you. Even if you've been avoiding your portal, like it's a bill notification, I'm not gonna lie, I have done that too. Even if last time you logged in was a different presidential administration, here's why you need it now. No more will call you with results. If it's bad, we'll reach out to you. No news is good news. I hate those. We are retiring. No news is good news. That might be cute. That might be a cute phrase for dating, but not for your kidney functions. The portal lets you see labs, imaging reports, sometimes. If you know, you know. Pathology in some systems. Yeah, if you know, you know. Visit documentation as soon as they are released. Sorry, I've got to put those little disclaimers there. Direct message, you can ask, can you clarify this result? Is this side effect normal? Should I still be taking these? Without doing a phone call, tree gymnastics, press 1 for the department that never answers. Or how about you just forget what was 1, option 2, option 3, option 4. I always forget. I have to press 0, it starts all over again. Anyways, visit notes and instructions. You leave a visit thinking, I'll remember this. No, you will not. Your brain is full. Your life is busy. The portal keeps your plan, your instructions, your diagnosis or diagnoses, sometimes your after visit summary, so you can revisit it when the kids are asleep, you're off shift, or your brain is calmer. If you're not checking your portal, you're letting everyone else write your health story. That's not empowerment. That's actually outsourcing. You're outsourcing your life. And you deserve better than outsourcing your whole health narrative. All right, we got a little serious. So, okay, let's loosen up. You know how some people have get your life together playlists? I don't have that kind of playlist, but I have others. Cleaning the house, doing your budget, organizing your life. You need one for your health admin too. I'm not going to sing, okay, out of respect for your ears. Maybe next one. But think about those songs that you say things like, this is your moment, get up and do it, something, get up and do something, take control. Everybody lose control. I had to whisper that. I didn't want to, like I said, hurt anyone's ears. That same energy, apply it to logging into that portal, updating your info, and checking your results. You are the main character. Moment in health is not just meal prep and gym selfies. It's reading your own chart. Now let's evolve this conversation. Patient portal equals your connection into one system or into the system. It could go both ways. I don't know why I did that to myself. But what about when you switch doctors, hospitals, health systems, states, jobs, insurance? This is where we graduate. Dun, 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 from I have a portal to I have a personal health record. Come on, get your graduation hat, your cap and gown, I should say, and get your diploma. A PHR is yours, not owned by a single healthcare network or hospital, not limited to one health system, not tied only to one app behind a brand. A PHR can be a secure app that connects to multiple portals. Come on, am I selling you here? Because I hope that you're like, oh, I need that in my life. A structured digital folder where you store your own downloads. A curated collection of your most important health data kept by you. Think of it like your health Dropbox, health Google Drive, your health passport. Not having a personal health record is like not having a passport. Yes, you exist, but your movement is limited. With a PHR, you can keep a running med list with doses you actually take. How important is that? A list of major diagnoses and dates, copies of critical lab results, operative reports. Come on, that's like the number one document requested. Allergy documentation, vaccine records, very important for kids, right? Discharge summary for major hospitalizations, So when you walk into a new doctor's office and they say, so what brings you in? What is your history? You're not starting from vibes and vibes alone. No, you're not staggering either. You have receipts. This is the image of receipts. And yes, HIM and informatics are pushing this future forward, advocating for interoperability, helping build PHR based on APIS, pushing for data standards. Please look that up, okay? Trying to make sure your data can move when you move. This is not just technology. This is mobility. This is freedom. Let's talk about what happens when you don't have a personal health record. You move to a new state, new job, new insurance, new doctor. Suddenly, every new provider is starting from where? Scratch. Medications get repeated, missed or misdosed. Labs get duplicated. You're paying and suffering for blood draws you already had last month. That surgery report from 5 years ago, nobody has it. And you're sitting in the exam room trying to piece together your medical life like a flashback montage. No. Without a personal health record, your medical history is someone's version of events. It's like a breakup. Incomplete, emotional, and missing key details. You deserve better than that. A PHR is not about being extra, it's about being prepared for emergencies, travel, new jobs, new doctors, caring for others, major life changes, like babies. Let's talk to my caregivers, parents, adult children caring for aging parents, partners, managing meds and appointments for each other. For you, portals and PHRs are not just nice tools, they're survival kits. You might be checking your child's vaccine history for school, for school forms, helping your mom remember cardiology appointments, tracking your partner's mental health follow-ups. Portals let you send messages, as I said earlier, direct messages to your provider, manage appointments, see instructions. PHRs let you keep the big picture in one place. See patterns over time. Advocate when someone is hospitalized and can't speak clearly for themselves. This is not hypothetical. This is real life logics. Now, from the HIM lens, all of this gold, patient using portals and keeping PHRs, catch errors faster, provide corrections, participate in their own record accuracy, help ensure data tells the story. From a quality and an equity point of view, people with more access and more understanding equals better engagement. Better engagement equal adherence. Better outcomes. Better outcomes equal fewer preventable communications. The communities that have historically been marginalized or ignored by the system, we're struggling to get that out. Portals and PHRs become tools of health literacy and self-advocacy. Okay, let's do a red flag check, advanced edition, which is another one. So, okay, in your head, if this is you, say, whew, okay? You still haven't logged into your portal from last health system. Whew. You changed jobs and lost access and never downloaded anything. You have no copy of your vaccine card anywhere digital. You couldn't tell me your current medication and doses without looking at the bottle. It's getting intense here. You don't know your last major lab values like A1C, kidney functions, cholesterol. You wouldn't know where to find your child's immunization record if the school asks tomorrow. You're going to do a phone call, aren't you? And ask for it to be faxed. Please send it to my email. If a new doctor said, what surgeries have you had? When? And you have to guesstimate. You move states. You have moved from a different state at least once and have no record from the last place. Your health story is too important to live only in other people's system. Your portal is your access. Your PHR is your insurance. No chain, just awareness. And now, action. Here's how you start your personal health record today. You don't need expensive tools. You just need organization and intention. Step 1, pick your home. This can be a secure app designed as a PHR, an encrypted note app, a folder in your cloud storage with good passwords, very important, or a structured document you keep safely, backed up. The point is one home base, not scattered screenshots everywhere. Step 2, gather the core 5 for yourself and for any family member you manage. 1, active diagnosis, main conditions with approximate dates. 2, medications, name, dosage, schedules, who prescribed them. 3, allergies plus reaction, meds to foods to substance. 4, key lab tests, A1C, kidney functions, cholesterol, etc. 5, immunizations, especially for kids, for traveling, and for chronic conditions. Step 3, download from portals. Most portals let you download visits, summaries. Export part of your chart. Print or save as a PDF. Start with the last 1 to 2 years. Any hospitalizations, any surgeries. Save them in your PHR, home base. Step 4, make it readable. Very important. You are not trying to recreate the EMR. No. You are creating your narrative snapshot, but of course with accuracy, okay? 2018 diagnosis with hypertension. 2021 started on metformin, 400 mgs, BID. 2023, hospitalized for pneumonia. This is what's new to providers, needs to grasp your story quickly. Just some, little bit of information. Keep it updated. Very important. Once a month or once a quarter or after a big health event, new diagnosis, medication change, hospitalization. Update your record. Again, I feel like I need to say that. This is not a one-time project. It's an ongoing, low-maintenance habit. Not like your financial spreadsheet that you have to update weekly or monthly, like I do. Your portal is your data lands. Your portal is where your data lands. Your PHR is where you curate it. So here's the truth. Your patient portal gives you access. Your personal health record gives you control. HIM plus clinical informatics gives you the infrastructure that makes it all possible. So, in the 21st century, because we're heading to 2026, your health data should never be a secret, a mystery, a rumor. Rumor has it. Wait, sorry. Or solely in the hands of systems you don't control. Your health story belongs to you. So today, if you do nothing else at all, log into your portal, start the framework of your own PHR, even if it's messy. Perfect it later. There's no such thing as perfection anyway. Even if it's small, even if it's just step one, it's fine. Because your future self, 5 years from now, in a new office with a new provider, will be so grateful you listened to this podcast that you did, that you started. This has been the Balance HI podcast with me, Samantha Louigene. If this episode opened your eyes, made you laugh, or finally guilt you into resetting that portal password, share this episode with someone who needs it. Follow the podcast. Connect with me on LinkedIn, TikTok, IG. You can also watch my YouTube shorts for more HIM digital health content and some spicy but educational breakdowns. And if you want to go deeper into how all of this fits into modern health information and digital health careers, grab my book, Digital Health Navigator. If you are a health information professional or a student and you want real templates, workflows, and tools, no fluff, check out my HIM toolkit. Because if you don't understand your own data, you're letting everyone else run your story. Stay informed, stay empowered, and stay balanced. I'll see you in the next episode.